Virginia. This is Virginia This Morning.
Well, last week we kicked off our plastic surgery series with a look at liposuction. Today's topic is tummy tucks. Lingering, hard-to-tone fat or excess skin around the belly prompt many to consider a tummy tuck as an option. Local plastic surgeon Dr. Louis Ladosi joins us this morning. Thank you for coming in, doctor.
Thank you for having me.
Yeah, a lot of questions really off the top, the difference between liposuction and a tummy tuck.
Liposuction is an operation that removes just fatty tissue. It will not correct excess skin or a loose abdominal wall. That's something that you really need a tummy tuck to correct.
Yeah, we have some pictures, so we'll look at those right away so we kind of have a clear picture of what we're talking about. Some before and afters. Tell us what we're looking at.
So what you see is a problem that's both above and below the belly button. There's excess skin and there's excess fatty tissue. You can't see it, but this patient has a loose abdominal wall after having children.
So this is post-pregnancy, and here's an after of that same patient.
And what you see is that she's traded the features that I just described for a scar that hides with all but the most dramatic bathing suits and underwear.
How far after surgery is this picture taken for the after?
This is about 1 year.
Okay, so scar still has some fading to do?
The scar generally takes about a full year to fade. With some people it's a little less, some people it's a little more.
Okay. A few more pictures to look at. We can kind of roll through those. This is the same patient. Obviously you can see the stretch marks, and a lot of women and men are dealing with stretch marks.
Unfortunately, stretch mark cannot be corrected without removing the skin that's involved. A tummy tuck will remove most of the skin between the belly button and your pubic bone, and those scars will be removed. The remaining scars are redistributed, they're moved downwards. The remaining stretch marks are moved downwards, but they cannot be removed.
So they're just kind of repositioned, and that's an after.
That's correct.
And I think those may be, oh, we have one more here. So this is again the before.
And this is just the same features from the side, and you can see in the after how you can really correct the shape of the abdominal wall. It's a very nice operation because it corrects the three problems that are responsible for her dissatisfying features: excess skin, fatty tissue, and a loose abdominal wall.
So who is the right candidate for this type of procedure?
The best patients are ones who are internally motivated, they're in good health, and they have been unable to correct their features through diet and exercise.
Now you say internally motivated, meaning emotionally, or that you want to keep the weight off after you've had a procedure like this? One
of the important things to understand about cosmetic surgery is that we can turn the clock back, but we can't stop it. And patients that are willing to make some investment in diet and exercise and their own habits are going to have a permanent correction in their features.
So you mentioned investment. I'll have to ask, if you're going in terms of looking at a tummy tuck, what kind of price point are we talking? Depending
on the situation, for the preoperative care, the operation, the facility fee, the anesthesia fee, all the post-operative care, it's somewhere between $6,500 and $7,500.
Okay, so you are making an investment there, and you want to definitely take care to keep that sustained.
That's exactly right.
Yeah. Risks involved with this type of procedure?
All surgery has risks. When you go through the process properly and you have a medical evaluation, you see a board-certified plastic surgeon, you have your surgery in an accredited facility, the risks are really minimized. The biggest trade-off with this is, again, the scar. And what you're really doing is trading a feature that you can't hide with clothing for one that you can.
New mothers, we talked about the pregnancy factor. This surgery happens much farther after pregnancy, or can you do it at after delivery?
After delivery is probably a little too soon.
Yeah.
You know, among the things that they don't tell us about when we're going to have children is the effects on your figure. Pregnancy will stretch skin, stretch the abdominal wall layer, frequently cause some extra weight gain, and this operation can correct all those things. But it's very wise to have the operation after delivery and your body is returned to its pre-pregnancy state, so you don't lose the benefit of the operation.
That's right. You got to kind of reshift back into position before you start considering.
That's right.
Yeah. Anybody who probably shouldn't start thinking about this kind of procedure, I guess you really need to be on board and committed.
You have to be in good health, and you have to have features that should be corrected by this operation. This is a tool to correct a problem, and you just have to find somebody who will select the right tool to treat the problem.
Fantastic. Great information. Thank you, Dr. Ladosi. Appreciate it.
Thank you. I really enjoyed being here.
Yeah, our pleasure. For more information on tummy tucks and any of the other plastic surgeries that we've covered in our series, you can visit our website at WTVR.com/VTM. Cheryl, a lot of important questions and some great answers.
Absolutely. I was taking notes. Thank you, Jessica.